We're fortunate that in Los Angeles there are so many programs to help people with AIDS. Money is being spent, but money is also being slashed to other programs. Today on AIDS Vision, you can find out where the money is being spent, where the money is being cut, and what you can do about it. Today on the City of Los Angeles AIDS Update on AIDS Vision. Welcome to AIDS Vision, and I'm Allison Arngrim, your volunteer host. Today on AIDS Vision we have with us Mario Solis-Marich, who is Director of Public Policy at AIDS Project Los Angeles. Welcome, Mario. Welcome back, I should say.
Nice to see you, Allison.
Good to see you. We've had you on before, but today we're talking about some new things that are going on in funding and in policy, and there's a couple of new programs that you're heading up. For those of you who haven't met him before, could you tell us what exactly you do as Director of Public Policy at APLA?
Well, AIDS Project Los Angeles has within the organization one of the largest public policy AIDS efforts in the United States. We do grassroots lobbying, from letter writing to actually training constituents on how to visit their legislators. There was a program called the Neighborhood Network. We monitor legislation, analyze new AIDS policy and healthcare legislation that comes on the state and the federal level. And we also participate on the county level in actually planning HIV services for Los Angeles County.
And you actually show people how they can personally become involved in this legislation.
Absolutely. We do that through two programs. One is the Citizens Network, which is a letter writing campaign.
Now, I've gotten mail on that. A lot of people have probably gotten that in their mail.
That's right, and we have over 10,000 members right now, which means that we've had like 500% increase in the last 2 years in participation there. And we also have a program called the Neighborhood Network, where people who have a little bit more time actually meet, have coffee at a neighbor's home, talk about current AIDS issues, and they go and visit their legislators.
So you're actually training people to go personally see the legislators, not just write to them.
Absolutely, and it's so easy for legislators to think that AIDS only affects certain types of people or that it's not happening in their district. And what we found completely compelling is training people on how to visit their legislators on the AIDS issues, informing them, and then they go and they visit and they say, hey, I live in your district, I vote, and this is what I think about HIV and AIDS in Los Angeles County, in the state of California, or on the national level.
And well, if they don't read their mail, obviously you've made a personal impression.
Absolutely. More and more what we're finding is that AIDS is less of a media issue. We don't get the big, splashy news coverage that we did 4 or 5 years ago. It's more and more become what we call a retail issue as opposed to a wholesale issue. An issue where you have to go in and visit your legislator and let them know that you're concerned about the issue. It takes that type of direct contact to get the message across now.
Well, something that's happened now that we're talking about specific issues is that, and people seeing AIDS is only happening to certain kinds of people, is there has been a cut. The CDC, Centers for Disease Control, apparently cut $6.8 million from programs that were specifically targeted to gay and bisexual men of color.
Well, actually,
and what happened?
Well, basically, the CDC cut came out of all minority prevention efforts. That $6.8 million was what actually came out of minority prevention efforts that targeted women, that targeted just general, minority populations, and a small percentage of that was at one point directed towards gay and bisexual men of color. What happened is that was completely lopped off.
The whole section was cut.
Absolutely. I mean, it was cut drastically. Over 50% of all the funding, which was inadequate in the first place, targeted to gay and bisexual men of color, was cut. And so nationally, I think that what the CDC is currently spending to prevent the spread of HIV amongst gay and bisexual men of color is probably under $500,000 nationally.
Nationally? That's not enough for the city.
Absolutely not. And what we're seeing is that in minority communities, nationally, about 48% of people of color with AIDS are gay and bisexual men of color. So I mean, the numbers have been there for a very long time. Those programs have never been adequately funded, and the CDC has seen fit to even cut those further.
But you're also saying they're cutting general minority-targeted programs.
Absolutely.
And don't we just read in the paper that the fastest-growing groups of people who are infected tend to be young women and teenagers and people of color?
Absolutely.
And they're constantly going on about the outbreak in the minority community, and yet you're saying that they just cut the education funding to that group.
$6.8 million from national minority organizations, money that was funneled out to the grassroots level to teach people how to prevent HIV transmission. And these are crucial efforts. I mean, there are two ways to look at this whole epidemic. We definitely have to continue to push for research so that we could find, a way to stop the virus, period. We need to funnel money into care so that those people with AIDS that are living right now could live longer and so that they could get the care and services they need. But we know that those funds are always going to be limited. I mean, we need to push for more, and we do, but there's never going to be enough. We need to get to the point where we stop this disease at the front end, because AIDS is completely preventable, and we all know that. And the problem is getting the message out in ways that, that targeted populations could understand and could relate to. That prevention effort has never been adequate.
But also,
and it's being cut.
Cheaper to try to prevent people getting infected than to spend the money on the health care that they're going to need?
Absolutely. Absolutely. It's cheaper, and in the long run, in order to secure more care dollars for those people who are already sick, or to stretch those dollars, you have to keep people from getting sick. So it's not only a issue around compassion and keeping people well and healthy, but it is also a fiscal issue. And the Centers for Disease Control has completely dropped the ball on this.
Is there a reasoning behind this? Is there some rationale? Was it just random? Were they just at the end of the line? What happened that these groups were hit so hard?
Well, what happened, I mean, what we've been told publicly is that there was an accounting error 2 years ago.
An accounting error?
2 years ago for the Centers for Disease Control made an accounting error 2 years ago. They rolled that over, and this is where the buck stopped, was this particular year. That could be all well and good. It's going to be difficult to ever track that to see if that's actually the case. But the fact is that the money that they spend on surveillance, the money that they spend on different administrative costs, that's where the cuts need to take place. The cuts do not need to happen in preventing the disease. We need to prevent the disease. The Centers for Disease Control has a mandate to control the spread of HIV, and they're seeing fit to cut that budget.
But I'm also thrown once again, I mean, the whole story of AIDS, constantly it's been blunders and all of these things getting in our path, and now you're telling me that a budget cut was not, in fact, an intentional move, or that there was a specific thought-out plan, but it was an accounting error.
That's what the Centers for Disease Control claims, that they had an accounting error 2 years ago, that they rolled it over, and that sooner or later it had to stop. And that level of incompetence, unfortunately, has not, you're right, has been the history of the federal government and controlling or helping people who are sick with HIV.
What is Call to Action? There is another program that you're involved in to try to alleviate this. What is Call to Action?
What's very, very interesting is that throughout the country, there are small community groups that are concerned with gay and bisexual men of color and HIV. The call to action was basically a few individuals that got together and said, enough is enough. As it is, there's not enough money being spent on prevention, for gay and bisexual men of color, and now they're cutting them even further. So this is where the buck stops in the community. So 4 individuals got together, went ahead and put out a petition, asked people to sign on, calling for the CDC to increase funding and to target programs more directly to gay and bisexual men of color. I was part of that group. We were absolutely surprised by the broad-based support from every single type of community throughout this country that signed on to that petition. We were touched, we were moved, and we were absolutely surprised. Now, there's this thing, people think that the country, I think, is they think the country is unwilling to confront these type of issues. The broad base of support that we've had on this particular call to action has been quite impressive.
So people aren't as far behind as we thought.
Not at all.
But isn't there a lot of denial? Because I think in a lot of people's minds there is a sense of denial. They do not see, you'll often hear people refer to gay white male. There are a lot of people who do not seem to see that there are gay men of color. And then there are people in the minority community who try to tell you that all of the people who have AIDS in their community are IV drug users or heterosexual, that there simply are no gay men of color. And that seems to be a problem. And then bisexuality in itself is a subject of great denial in this country. So do you feel that that is a factor in the cutting of the funding and people's relating to it?
It's absolutely a big factor. I mean, the CDC, under the current administration, has been unwilling to fund programs targeted to gay men and bisexual men, period. The denial, for instance, in the Latino community around the existence of gay Latino men has fed right into that, and they have created a type of unholy alliance with, quote unquote respectable people in the minority community who would rather not take a look at the issue of homosexuality in minority communities. However, we have found enough allies throughout the country that are willing to say, hey, enough is enough. This is it. You can't continue to cut these funds. As a matter of fact, you need to increase this funds. As a matter of fact, it's more than just a funding issue. The CDC has to change its attitude around how it deals with gay men of any color, regardless, making those that information more targeted, more specific, and more appealing to those populations, whether Jesse Helms likes it or not. And that's really the big problem. Anytime a message is articulate, open, and explicit, as we've seen throughout the world that it needs to be in order to prevent the disease, people like Jesse Helms and William Dannemeyer start rattling in their cages, start knocking on the CDC door, and the CDC has been unwilling to stand up to people like Jesse Helms.
Do you really feel that Jesse Helms single-handedly, or with Dannemeyer, that they are really that major element
absolutely. In this? We were talking earlier about the Reader's Digest article that looked at one program that specifically targeted black gay men, and that there was an absolute uproar in Congress about, because for no other reason that it was explicit and it was an effective tool.
Well, one of the things about the program, too, is that it was black and white men together was the organization. And I think that may have struck a nerve with some people, because if it was just black gay men by themselves, there might have been people who would have gone for it. I think several people's nerves were struck.
Yeah, and it continues to be an extremely effective program. Whenever we get into appropriations for the Centers for Disease Control, you always have Jesse Helms going in there and saying, well, it can't be this explicit, or you can't do this, or you can't do that, or you can't promote homosexuality with these, prevention dollars, as if anybody, as if it were possible to promote homosexuality. And, and Congress has backed off and the CDC has backed off, when the fact is, if, in fact, when Jesse Helms brings up those issues, when William Dannemeyer brings up those issues, the CDC should go and say, this is a health care issue. This is a health care issue. This is not a political issue. This is not a civil rights issue. This is a health care issue. These are the statistics. This is how you stop people from spreading HIV. This is how you teach people how to take care of themselves and take responsibility. This is what works. And that's what we should be concerned about.
Mario, we're going to go to a roll-in now, and we're going to show you an event that neither Helms or Dannemeyer will be at.
Dance, dance, dance for the right thing. Dance for the right thing. Dance at the party of the year. Yes.
Join the AIDS Dance-a-thon benefiting AIDS Project Los Angeles, Sunday, March 29th. To register, call 466-9255. It's a fundraising extravaganza.
So dance.
Yes, the dance-a-thon. I somehow think Jesse Helms won't be there, but hey, he's invited. Come on down, I dare ya. My name's Allison Arngrim, and I am your volunteer host on AIDS Vision, and we still have with us Mario Solis-Marich. One of the other programs I wanted to ask you about is what is going on with case management for people in prison with AIDS.
Actually, we just had, this has always been a big issue for people who have HIV or actually have an AIDS diagnosis that are either in the county jail system here in Los Angeles or happen to find themselves in the prison system. Some of them are just supposed to spend 2 or 3, 4 years in prison or maybe 4 months in jail. And that could be a very, very deadly situation for somebody who has AIDS that is not receiving care. At the same time, both institutions, the jail system and the prison system, are very, very difficult institutions to deal with, obviously, and the populations are difficult to deal with. What we have done over this past year, especially on the county level and on our own state level, has been to negotiate and push both the jail system and the prison system to track people with AIDS better, within those confines, and to provide adequate care for them. This has not been easy.
No, I'm just remembering I have visited women with AIDS in prison, and one of the things I remember is that in some cases there was literally no care provided, and then in some cases inadequate care. One of the things I know that happens is when you go to jail or prison, any medications you're prescribed that you brought with you are initially taken from you.
Absolutely.
They are returned to you at some point, but there can be a delay, days, weeks, and in some cases, if there's a bureaucratic error, months. If you're on AZT or one of the medications for AIDS that you need to take several times a day in order to keep your condition from progressing, and your medication is cut off for 2 months, what happens to someone with AIDS in prison when they cut off their medication?
Right. Well, let's take a look down over to the jail system. What happened was the way that we were initially involved is that we had a volunteer at AIDS Project Los Angeles who was also a person with AIDS, who got picked up for a 502, got put into the local jail system. AZT was taken away, and it was weeks before that he was stuck in the jail system, and it was weeks in that jail system that he went without receiving his adequate medication. What we found it necessary to do at that point was obviously advocate for that individual, and as we were advocating for that individual, we saw the whole host of problems.
Everyone else was sitting in jail with no AZT either.
Right. We have been working with the medical director of the county jail system, and they have now opened up the system to case management. And basically what that means is that there'll be an advocate or a series of advocates within the jail system, in order to, to be able to come in contact with people that want to disclose as having AIDS, to make sure that they're getting their adequate medication, and to make sure that as they exit the system, that they are in contact with, a place where they could continue to receive health care.
But this is before they leave, because there's been systems before where, as people exit prison, they are directed towards case management, but these would be people before they have left the jail or the prison being assigned.
The goal is that as soon as somebody starts to exit the system, or in the jail system, that could happen at any point. So in the jail system immediately, there would be a discharge plan for that person put together, and that person would be connected up with the type of mental health support that they would need, the type of medical care that they would need, and the type of ancillary care or psychosocial support that they would need so that they could maintain their health.
Now, is medical care in the prisons being improved? I know that there's extremely short shrift for women with HIV in prison. A couple of years ago, I heard stories about people receiving absolutely no dental care, being denied medical care for months at a time because there simply was no one available, let alone anyone who could work with HIV.
Well, I'm a doctor by the name of Herman Maisonet has done stellar things in the state prison system as far as medical care. He just happens to be on the board of governors of AIDS Project Los Angeles. We're really proud.
And we have to have him on because I know him too.
Yeah, he's wonderful, and it's like a great. He has actually pioneered medical care for people with AIDS within the prison system. But the psychosocial aspect of it has been very, very difficult to break through on, because the jails like to keep, as little outside influence within the populations as they possibly can. What we've been able to do, though, is that through negotiations and through community support, we've been able to crack through that system, and hopefully those programs will be put in place by the end of this calendar year.
So it hasn't happened yet?
No. But
now, are you having difficulty getting support for it, because these are people, not only people with AIDS, poor people, people of color, but they're people who are in jail? And some people may be able to identify with that and say, well, they've just been arrested, but what about people who are in prison who have been convicted of, say, robbery, drug offenses, what have you? Do you have difficulty getting sympathy or support for these people, even though that they have AIDS?
I think, one of the things that we're very, very familiar with at APLA, or, in the AIDS arena, is working with and for people that don't necessarily have a lot of popular support. The fact is, if somebody is doing 5 years or whatever, any length of time for a robbery or something, I'm sure that the majority of people would say, well, that's true, they need to pay that debt to society, but it's not a death sentence either, and that's what these folks are facing. If they don't receive adequate care, they're facing early death. And what we found is that when you put it into those terms, most people agree. That's right. They have a debt that they have to pay to society. That's true.
I mean, is there a constitutional angle of cruel and unusual punishment in some of these cases? Because of their condition, they're being put into very unusual circumstances.
In other states, those cases have been forwarded in that way. I think we're finding throughout the country that this is a very difficult issue, for communities to deal with. It's been a difficult issue for the prison systems to deal with, and I think we're very fortunate that we've been able to make these breakthroughs here in the state of California and within the county of Los Angeles.
Now, do you also do outreach when the people are being assigned case management to their families they may have on the outside?
That's actually
getting them hooked up too.
Those type of programs are being developed right now. I think what we're going to find is a different model of care, and probably what's going to emerge is a more comprehensive one. Anything would be more comprehensive than right now, but I think we'll see those type of packages.
Because I've seen those situations where women in prison who they're pregnant, they have AIDS, they have a baby, the baby's then sent to relatives, they are separated from the child, and you have a child with AIDS and a mother with AIDS, and trying to access both of them and get them both care.
And that's
there was nothing.
Exactly, and that's even difficult on the outside. I mean, that's just a problem in general with our healthcare system. I think what we're finding, though, is that because of of some funding that has finally come through on the federal level is that there is a community standard of care that's emerging, and there's a system that's emerging, at least in the most heavily impacted cities, which LA is one of. So we're finding this system of care emerge, little slowly but surely, and hopefully those gaps will diminish.
So there finally is a standard being set that we can aspire to.
Aspire to, exactly.
What can people do, people who are watching this now and want to be involved in any of these programs, Call to Action, Citizens Network, be trained to be a virtual lobbyist in the neighborhood network, get involved even in helping with the prison program as it gets put in place? How do they contact you? What can they personally do?
Well, they could call me at APLA at extension 572. Do you give the number?
962-1600, 572.
There you go.
There, it's done.
And if somebody has 20 minutes a month and they want to make a difference, they could sign up for the Citizens Network, which is a letter writing campaign. We keep them informed on current AIDS issues. They get a letter in the mail. There's even a model letter that they could follow if they feel they're not great letter writers. Those type of contacts with legislators are very, very important. If they have a couple of hours a month that they'd like to devote to this, then they could be part of the neighborhood network, which means that you sit around with some of your neighbors, for an hour and a half every month, have some coffee, talk about current issues, and then you go and you visit your legislator and say, I want something done about HIV.
I'm going to encourage people to call you. We're going to wrap up right now. I want you to call Mario, and afterwards I'm going to talk to you because I'm willing to go talk to the legislators and be in the neighborhood network. Like I have a couple more hours a month. We know I don't, but let's do it anyway. Thank you for watching AIDS Vision. I'm Allison Arngrim.